Hey everyone, welcome to my channel Medical Lectures and Mnemonics. Today I'm going to talk about a very important topic, which is the history taking. So as you all know that the diagnosis of a case requires three things. One is the history taking, the other is doing an examination, the other is investigation. So without history taking we cannot do examination and we cannot do investigation about the case. So history taking is very important, and the history will guide us which part of the body should to be examined and which investigation should be done. Now to take history, there are some ethics which should be followed during taking history. So first, approach from the right side of the patient, greeting him and introduce yourself. Then that I'm Dr. Masiullah and I'm going to inquire about your disease. So you should to cooperate with me. So the first thing that you should ask in the history is biodata. In the biodata, ask about the patient name, their father name, or their husband name. Then ask about the patient age, their marital status, their occupation, their date of admission and mood of admission. So whether the patient is came to the OPD or to the emergency. And each part of the history has its own importance, which I will discuss in the another video. So the first thing in the history is biodata. The second thing in the history is chief complaints. The complaints by which the patient is presenting to the doctor is the chief complaint. So the chief complaint should be in chronological order. Mean the complaint which start first should be written first. In the complaints which start later should be written later. Then ask about the history of presenting illness. In this portion of the history, you should elaborate the chief complaint one by one in paragraph. So if the chief complaint is pain, then describe the pain by a mnemonic, which is the Socrates, Socrates, Socrates. So describe the site of the chest pain. S means site, and O onset of chest pain. And ask about the character. C stand for character. Character means that the pain is burning, or the pain is sharp, or the pain is tight. So then ask about the radiation. The radiation of the chest pain, whether the pain is localized or whether the pain is moving back or it move upward into the shoulder or into the neck. Fourth thing in the about the pain should to be asked is the association, whether the pain is associated with any other symptom or signs. For example, the pain may be associated with vomiting, it may be associated with cough, or it may be associated with other symptoms. So the fifth thing is the time, whether the pain follow a pattern of time, how much the pain is lasting. In the third, in the sixth thing in the pain is the E, which is mean exacerbating factor or relieving factor. Is there anything which aggravate or relieve the pain? For example, the pain may be aggravated with moving, or the pain may be relieved with rest. And the last thing in the pain history is the severity, whether the pain is severe or not severe. You should ask about this thing about the pain. Here the fourth step in the history taking is the post history. Post history is further divided into post medical and post surgical history. In the post medical history, ask about the diabetes, hypertension. Also ask about the cardiovascular abnormality, and ask about the TB or any other medical condition. And the post surgical history, ask from the patient about any previous surgery. So the fifth step in the history taking is the family history. Ask from the patient that whether he has any family history of diabetes, hypertension. The sixth step in the history taking is the drug history. Ask from the patient that which type of drug he is taking in the current, or he has taken in the previous, and also ask about their dosage and the time of dosage. And ask about allergy that he developed to any type of drug. Seventh step in the history taking is a socio-economic history. Ask about the patient, about the home, their washroom, whether the washroom is shared by all the family members, and ask about their income status. So in the last step in the history taking is the personal history, in which we inquire the patient about their personal habit, their appetite, whether the patient is taking alcohol, or whether he is smoking, or whether the patient is taking snuff. So this would be asked from the patient, and every step in the history has its own importance, which I will discuss in the next video. And the last step in the history is the summary of the history. In the summary of the history, you should review the history, whether there is any step missed or not, and you should also repeat the history to the patient in order to correct you when there is any misunderstanding or error in the history. So the after history, you should review the each system of the body. The system that is to be reviewed are the CNS, the CVS, then the respiratory, and then the GAT, then the genitourinary, and so this system should be reviewed in the history taking. So this was all about on history taking. For more videos, subscribe, like, and share. So thanks for watching the video.